Pediatricians released 2 more controversial studies just this past week. The journal Pediatrics reports roughly 10% of shy teens actually have a social phobia, and they could benefit from treatment. And then there's the other study. That study looked at hyperactive kids. Frustrating for parents, it's a headache for teachers. The current standard is to wait until age 6 before you consider medication, before you actually treat it. Well, now there's a study by the American Academy of Pediatrics. It recommends treating earlier, starting medications such as Ritalin in children as young as age 4. So when kids are medicated to learn, or to fit in, are we really leveling the playing field, or is it just kind of parenting in a bottle from parents who want to their child to outperform other kids? Psychiatrist Reef Karim is here. Dr. Karim, we can start wherever you want. We can start with the shyness, I guess. When is a child that is shy actually a phobic child?
Well, we all know we're in a prescription pill epidemic, right? And everybody's popping pills for all sorts of things. So we don't want to over-medicate our adults, let alone our kids. And so this study, it was the National Institute of Mental Health, and they looked at 10,000 kids, and they wanted to assess, well, were the ones that were shy actually socially phobic? And socially phobic means, yeah, you've probably seen somebody like this. I've seen patients like this all the time. They tremble. They literally sweat. They get nauseous doing basic things, that everyday things that we do, like eating or going to a public urinal or restroom or just speaking in front of other people. They freak out so much that they become incapacitated. So some people thought that that's an extreme form of shyness. And this study looked at it and said, no, these are 2 completely different things.
You know, when I listen to a study like both of these studies, and it's medication, this or that or the other thing, sometimes it seems like it's an excuse instead of doing therapies or working harder as a parent and working to get your children the help they need instead of just giving them a pill to solve it quicker.
Yeah, Jeff said a great thing. He said parenting in a bottle. That is a great statement, because some parents don't have the time or the ability or even the skills to, at that point in time, to say, look, I'm going to take you in and I'm going to do what I need to do to parent you. Instead, they're like, here, take this pill. And that's what they do instead.
Find the ability.
But when we were growing up,
Exactly.
we weren't given pills at the age of 4. We were your kids, you're hyper. That's what kids do.
Yeah, it's social skills training where you have a group, and within a group you learn how to do things, cognitive behavioral therapy and exposure therapy.
I talked to one psychologist and psychiatrist who said CBT, cognitive behavioral therapy, really it doesn't work for 4-year-olds.
It's very hard to get a 4-year-old to sit down. Right, but there are certain things that you can do as a parent, and sometimes just basic individual therapy causes somebody, can cause somebody to be less hyperactive or pay more attention to things.
Dr. I want to, because we're kind of getting out of time, I want to make sure we get down to ADHD and treatment. Is this a good idea from the American Academy of Pediatrics, or are they diagnosing too young?
The brain is developing all throughout our childhood. If you give medications unnecessarily to a kid who's got a developing brain, we don't know how bad those effects could be.
And yet they say if you don't medicate the child, you miss the windows of opportunity to teach that child to socialize.
If the kid truly has ADHD and it's significantly impairing their life, they should be medicated. But anything above that, no way they have medication.
Who should be testing? Where should you go to get these types of tests?
A child psychiatrist. Not your neighbor, not your teacher. No offense to teachers, I love teachers, but it should be a hardcore professional that specifically deals with this kind of stuff.
And there is a cost to that. It's a significant cost, because it's there's a battery of tests.
Yeah, there's some free health clinics that have child psychiatrists, but yeah, usually there's a test.
All right, Dr. Reef Karim, thanks for coming in. We appreciate it.